Hi, I'm Dr. Piechowiak, and I'm an interventional radiologist with IR Centers. So I wanted to talk to you today about uterine fibroids. Uterine fibroids are a condition that is very common in women and leads to problems with severe uterine bleeding and also something called bulk symptoms. Bulk symptoms are related to the enlargement of the uterus from these benign tumors, which are uterine fibroids. The symptoms can be very debilitating for women and impact their quality of life. So there are a few treatment options for uterine fibroids. There's medication. There is something called a myomectomy, where you can surgically remove the uterine fibroids. There's hysterectomy, which is complete removal of the uterus. And then there's something that we do that's uterine fibroid embolization. Okay, what is uterine fibroid embolization? It is a minimally invasive treatment to shrink down uterine fibroids and treat the underlying symptoms that goes along with it. So what we're doing is we're making a small puncture. We usually make a small puncture in the wrist. We sometimes will go through the groin, and we'll track a catheter all the way down into the uterine arteries. And from there, we'll do an angiogram to confirm that we're in the right area. And then we embolize. And what does that mean? We're injecting these tiny little particles that will stop the blood flow to the uterine fibroids. And once this happens, the uterine fibroids will slowly shrink down over time, and that will result in a decrease in uterine bleeding and improvement in bulk symptoms. It's something that does take a little bit of time. Most women will start to experience improvements in their symptoms by 2 weeks, and most will have an improvement in their symptoms by 1 month. It's about 90% effective in treating these symptoms. So what can you expect on the day of the procedure? You're gonna come in about an hour beforehand. We like that you don't eat anything or drink anything for 6 hours before, because it's done under moderate sedation. You'll get dressed, you'll get some Valium to relax you, and then we'll bring you back into the procedure room. The procedure takes about an hour, and afterwards you just have to lie flat for 2 hours, and that's to prevent any bleeding from the puncture site, and then you get to leave with a Band-Aid on your leg.